Welcome to Meet the Partner, Saving Lives by Understanding the Role of Pediatricians in Treating Adolescent Substance Use. My name is Jeff Bornstein, and I'll be running this Dialogue for Health web forum with my colleague Merlene Tucker. Thank you to our partner for today's event, the National Overdose Prevention Network. Now it's time to meet the moderator of today's event, Dr. Carmen Rita Narvaez. Dr. Narvaez is the Public Health Institute's Senior Vice President of External Relations and Preventative Medicine, Director of the Center for Health Leadership in Practice, and Director of Dialogue for Health for the Public Health Institute. She is also the Director of the California Overdose Prevention Network and the National Overdose Prevention Network. Welcome, Carmen.
Thank you, Jeff, and good morning or afternoon, everyone, to wherever you are. We really are delighted to have you joining us for this important conversation. Since substance use or abuse often starts when we're adolescents, we wanted to take time today to just converse with someone who is really, truly an expert in this field and to see what her thoughts are and the kinds of questions that you may have about addressing the problem of substance use and disuse in this age group. So our learning objectives for today are just to briefly introduce the National Overdose Prevention Network, to talk about the role of pediatricians in overdose prevention, and to explore how we can build even more effective partnerships with adolescent treatment providers. Next slide. We will start with a poll, and this will help us to understand, and also the audience to understand, how many of you out there are partnering with or representing a pediatric adolescent medicine specialty. So if you'll pull up that poll, and I would like you all to just take a moment to check the right box for where you are. And then after I introduce and open, we'll come back and look at the results, and you can all get a sense of who else is in the audience with you. Again, I want to just emphasize, we want your questions, we want your comments and your thoughts, so don't hesitate to say what's on your mind by just typing into the Q&A box. So let's talk about what NOPIN is and what we can do to support your work. Back in 2018, our team at Public Health Institute's Center for Health Leadership and Practice launched a statewide forum for all coalitions, individuals, and organizations that were working to combat the opioid crisis in California. Through that work, we've established a very successful statewide network, and we're serving over 33 million Californians. Our success has really been based on the experience of running a national leadership academy on behalf of CDC, which has served more than 125 communities nationwide. We've learned what it takes to drive local change for complex problems like overdose deaths. The ingredients are strong collaborations, because stopping overdose deaths requires collaboration from all of the members of your community. Really strong partnerships are really needed in order to make this work sustainable and really increase the reach. We know that you must leverage the assets that you have in your community. Bring everybody together to implement what your community feels that it needs in order, and align that with evidence-based practice in order to really reach the results in a lasting way that you all know that you need and want. Work across sectors, get everybody to the table, and adopt what works. Don't bother to reinvent the wheel. There is very good evidence out there. We have a great library of how different people have implemented those strategies, how to implement the evidence, and we look forward to hearing from you what some of your ideas are and what some of your experiences have been in implementing what works. We use a prevent, manage, treat, and stop framework in a lot of what we do, so you'll see that in our materials. So we're taking this network nationwide to help you save lives in partnership with partnerships and strategies and resources for overdose prevention. Next slide, please. Okay, so it's really, truly a pleasure to introduce Dr. Sharon Levy. She is a board-certified developmental behavioral pediatrician and assistant professor of pediatrics at Harvard Medical School, and also the director of Adolescent Substance Abuse Program in the Division of Developmental Medicine at Boston Children's Hospital, which is comprised of clinical, research, training, and policy arms. She's evaluated and treated thousands of adolescents with substance use disorders and has taught national curricula, published extensively on outpatient management of substance use disorder in adolescents, including screening and brief advice in primary care, which I know many of us really want to hear about, and the use of drug testing and outpatient management of opioid-dependent adolescents. Before we hand her the mic, let's take a really quick look at who our audience is. So it looks like we have a lot to learn today because nearly 3/4 of us have not yet worked with an adolescent medicine specialist. And so we very much want to hear what you have to say, Dr. Levy, and I will turn the microphone over to you.
Thank you. And thank you for inviting me today. It's such an important topic and it touches so many of our lives. So it's really a pleasure to be able to address the audience and share my thoughts on it. Come at this as a slightly different perspective, working with younger people than folks who work with adults might. So, and I think that there's just so much that we can do, right? If we can get to the problems early and divert them. So, Carmen, you had asked me to talk a little bit about myself and the role that I play.
Yes, that is exactly correct. Let's go ahead and just start with what your story is and figure out where you fit into this, found your road to where you've landed, and get you started on telling us a little bit about why that's important.
Great. So I am trained as a developmental behavioral pediatrician and also an addiction medicine specialist. And about a little bit more than 20 years ago now, a philanthropist family made a donation to my hospital, Boston Children's Hospital, where I was just finishing up my training, actually. And the donation was devoted to opening up what ultimately became the first substance use disorders treatment program at an academic children's hospital. And so the hospital made that commitment, and then they went looking for a director, and I raised my hand. And the story is as simple as that. If we're going to be completely honest, I'm not really sure that I was all that well qualified back at that time. But I was somebody who was willing to take on this undertaking, which, I think I may not have realized at that moment, what I was getting myself into. But there really were no models, there were no role models, there were no examples that we could pattern ourselves on. So we had really a wide open space in front of us, and got the opportunity to really figure out what some programming should and could look like. And over the past 20 years, we've been really working on and building up the treatment services that we offer in the subspecialty treatment program.
So what do you think is most important for understanding why the adolescent medicine perspective is different? What do we need to think about when we think about adolescents and their risk for substance abuse or substance use? What are our key elements to sort of be prepared for?
Well, that is exactly the right question from my perspective. So what we understand about adolescents is that they're in a period of very active brain growth and development. It's really remarkable that this was not well recognized until 50 to 100 years ago. People, when they reached 14, 15, 16, until fairly modern times, were really considered adults. And it's really this modern concept that adolescents are a distinct developmental phase. Now, anyone who has lived or worked with adolescents or been an adolescent themselves will recognize that, this is actually, it's pretty remarkable that we were able to miss that, because I think, nowadays we really recognize that so much is distinct about adolescence. But one of the, but that active brain development really has a large impact on behavior, and also on, certain vulnerabilities. So we know that adolescents are more interested in risk taking. That's natural. It's actually healthy. It's something we were evolved to do. But it also puts us at risk, and especially in modern society, one of the big risks is going to be substance use, right? And so, the way that I think about this is that if, as a culture, we make substances available, the part of the population that's going to be most interested in trying them is going to be our young people, right? Our adolescents and young adults. And it's not only that substance use is sort of attractive because of, because of the risk taking and the sort of the different kinds of behaviors we see in younger people. It's also true that the parts of the brain that are developing during adolescence are really important to protect us from addiction. And so here's a group of people that are attracted to substance use and yet don't have the neurological hardware that prevents them from developing the disorder of addiction. And so they're a very, very high risk and vulnerable group. And so they're an obvious group where it's an obvious point to intervene, right? To try and deflect substance use early. It's, right before or as people are starting to really try and identify that and intervene really early, we can do a remarkable amount of good by preventing people from ever getting to the point of addiction. So I think that that's really critical. And I told you about the substance use disorders program that we opened at Boston Children's Hospital a couple of decades ago. And there we treat kids who've primarily who've developed substance use disorders. But one of the issues for me was that waiting for kids to develop a substance use disorder, I mean, it's very important that we have treatment for that population, but it's somehow it feels like it's missing something, right? Why can't we go upstream and see if we can really start doing things before the problems develop? And so about 5 or 6 years ago, our program started partnering with pediatricians all over the state of Massachusetts to see if we could identify programs earlier, and then not only identify them, but actually start treatment earlier. And instead of bringing kids and families into a subspecialty, tertiary treatment facility, we could actually deliver care right in the community, right in their pediatricians' offices. And that's a lot of the work we do. And a lot of that work is preventive. The goal is really to deliver substance use disorder treatment, of prevention and treatment of all kinds. I am a firm believer that, well, I'll tell you, in my more than 20 years experience in working with this group, I have not met anybody who had become addicted to opioids or had overdosed on opioids who did not first have a long history of using cannabis, nicotine, alcohol. And so identifying that early use and deflecting it is, we don't always think of that as prevention of opioid use disorder, but actually, it's a really key critical piece, because it's the kids who start developing problems with the other substances are much more likely to go on and develop opioid problems and be at risk of overdose. So we wanted to see if we could get to those kids, we could get to them early, and we can move beyond just sort of recognizing it and identifying it, but really move into treatment and helping them change their behaviors.
So I'm wondering if you could just talk for a moment, maybe what are some of the early, sort of the early signals that could help parents, teachers, communities to recognize and help to engage young people who are at higher risk than others?
Yeah, well, I'm going to back that up just a little bit and answer a question that you didn't ask and start by saying that really, I encourage parents and school staff, coaches, certainly health professionals, really all of the caring adults who work with kids or interact with kids, really the best message for them is that choosing not to use substances is really best for health and best for development. Now, that doesn't mean that's going to stop all kids from using all substances. We know that. But I think it's really important that trusted adults really speak with one voice. And the way that I think about it is our kids are exposed to messages that promote substance use throughout the culture 100 times a day, right? They see alcohol ads, there's lots of promotion around vaping and cigarettes and tobacco, and these days cannabis. And so there's lots and lots out there that's promoting substance use. And there are far fewer opportunities to really tell kids the truth, which is, hey, your brain and body are developing right now. And really the best thing for your health and your long-term health and your development would be not to use any of these substances. So I like to start with that because I think that it's important to put that universal prevention piece out there. I think that a lot of adults want to be very practical, and so they can sometimes be afraid of that message saying, well, I know kids are going to drink, so what's the point of telling them not to? Well, I still think it's we can say it clearly, and that that doesn't mean we're going to judge harshly kids who use substances, but really to put that clearly out there to help balance the score and help kids really think about this. You asked, how do we start knowing when somebody is showing signs of developing a problem? There are a couple of screening tools out there that are used widely, certainly in Massachusetts, but I think in other parts of the country too, that are meant for medical settings to really help identify kids who are at higher risk of having a substance use disorder. And actually, and fairly remarkably, these tools are really, really very simple. All of the tools that we're using these days, or the primary ones, more popular ones these days, are simply based on reports of frequency of use. So I want to warn you that these are like screening questions that have been carefully validated. And so in order to really get them to work well, they have to be asked exactly as they've been developed. And so we really recommend that when you're going to do screening, that you do it, you do it with a piece of paper that has the questions exactly as they're supposed to be. They're really meant for healthcare settings, but using these tools, which can usually be answered in far less than a minute, about 30 seconds, we can identify kids who are at high risk of having a substance use disorder currently. And we also tend to pick up issues around kids who may not have a substance use disorder, but are engaged in high risk behaviors. For example, about 4% of kids in our practices report some non-medical use of opioids in the past year. So those are kids, the vast majority of them don't have a substance use disorder, but it's really wonderful opportunity for us to be able to provide them some education and some advice, before they go down, before they do develop symptoms or a problem.
Yeah, one of the questions from our audience is how to make sure that we can quickly incorporate strategies or screening strategies into practice, because the time for visits is always limited. And I'm wondering if maybe you could comment on that, but also if you would mind sharing some resources with us so that we can make sure that we post it on the website for people that actually want to take a few minutes and look at some tools and see what could be useful to them in the work that they're doing.
Yeah, absolutely. So time is always of the essence when we're talking about healthcare appointments, and especially primary care, especially preventive care for adolescents. There are thousands of things that we'd like to cover. So, what I would say is that, especially these days, I think use of a portal is becoming more popular. And a lot of our partner practices are asking parents of younger kids or patients themselves for adolescents to fill out questionnaires in the portal before their visit ever begins. Now, of course, that's going to be harder for people who may not have the technology that allows them internet access and all of that. So, I think that hybrid strategies are always the best, right? So for people who can get on the portal and answer those questions before their visit, that's really wonderful. A lot of our practices for kids who couldn't or didn't answer the questions beforehand, they'll either hand them an iPad that belongs to the practice, have them get on right there, then and there, right as they're having their height and weight done, they can answer a couple of questions, or do it on paper if there's if computer resources are limited. So I think that a lot of practices are already screening for things like depression, anxiety, symptoms of ADHD, and so I see substance use disorders as really just part of that package, really something that can be rolled right in. And so then when the primary care provider sits down with a teenager, they can really see the whole picture and say, okay, this young person is endorsing some symptoms that of anxiety, also telling us about some regular cannabis use. Let's see if we can wrap these two together and guide that person to the right treatment to take care of both of them, because that's really what whole person care is really all about.
Yeah. Yeah, it's a very good point. Well, there's another aspect of this that came up in the Q&A, and I think it's important to take a moment. What if you're working with an adolescent who has parents that are users, and how can we reach out to them? Both because we know that does increase their probability of having a substance use disorder later in their life, but because they may feel tremendous responsibility towards their parents and not know how to open a conversation.
Yeah, there's been some work done actually around parents and their feelings about being screened for their own substance, about their own substance use during their child's pediatric visits. Most of this work was done with parents of young children, but what we know is that parents are really open to it. Having pregnancy is, for women, and I think being an expectant father as well, it's really a moment when people are more amenable to change than at other times in their life, right? So parenthood is really a great link into thinking about one's own behavior. We work with adolescents. It's family history of substance use disorders is pretty common amongst the population. I just want to say that I work with a lot of parents who have substance use disorders themselves. Many of them are I would say none of them want their children to have substance use disorder. So they're often very, very concerned. And just because they have experience with a substance doesn't mean that they're comfortable with their child using it. I would say they're all also, we do screen parents very briefly in our program. We don't treat parents, but we do recommend that they seek their own treatment. And I think that saying to a parent, this is really something that I recommend that you do, is often very, very moving, especially if they can say that in front of their child. That's often very moving to both parties. And I've had families where that has happened.
Well, that's very useful to hear. I wonder, since this whole series is about partnerships and trying to think about how we, especially communities, can engage parts of their community that perhaps they never thought of. What are some of the partnerships with community drug safety groups or substance use groups that you have seen that you think the partnership part that works really well, either being invited in to speak or being an active member of? Any experience with that you'd care to share?
Well, it's a great question. I mean, one of the things that I think about frequently is, how schools are places that kids pass through. It's very much like primary care, right? But it's even more so because kids spend their time in schools, right? They spend, as much time in schools as they do anywhere else. And so, having strong partnerships with schools and seeing that as an opportunity to provide, resources to guide kids. There are complications with doing that too, right? There are issues around confidentiality. There are all kinds of issues, but our group has worked with school systems to provide some nicotine education and also some peer-to-peer therapy groups in school settings. And what we have found is that it's very practical for kids, right? Because they're there and it's, there's a certain level of convenience, and it's a great place to introduce some things that rely on peer support and peer counseling. So I think that I think that those are really important thoughts of where can I partner? Where do we have kids? Again, it goes back to thinking about our decision to try and decrease the number of kids that we were bringing into a quaternary care treatment program, in the middle of a busy city, and saying, where can I push support and resources out to the places where kids actually are, right? So let's maximize their convenience and see if we can get them to engage that way.
Yeah, important points that you're making. I think one other thing that we'd like to hear a brief word on, since we're just about at time, is if you have any thoughts about how to help build the resilience of our young people and how we can partner more effectively to help build their resilience.
So, one thing that I know about substance use disorder treatment is that having these kinds of caring relationships, I mean, so much of it is about relationship and relationship building. So much time is spent really working on destigmatizing the condition, even with parents, about really working to help kids and their parents incentivize good choices and healthy choices. And I feel like when you build that in, when you are motivating kids to get involved in treatment because of the benefits it provides them, rather than what we're so used to hearing, you better do this or else, or you better not do this or else. But if you can flip that around, I think that really does build resilience. It builds relationships, even between kids and their parents, which are obviously lifelong relationships, and so often are stressed by substance use and substance use disorders. And so really starting to rethink that and turn that around, I feel like is one of the great ways of doing that.
Well, I want to thank you for taking your time to be with us today. It really matters to have a conversation with somebody like you who has the experience that you have. And clearly the kinds of questions that our audience had were very, showed a real need for the type of knowledge and experience that you bring. I will tell everybody in our audience, we'll do our best to get some screening tools up and answer some of the questions that you all have shared with us. We know that there's never enough time to answer everything. And with that, let me just go to the next slide and remind everybody, and then also to let everybody know that we do have a National Overdose Prevention Leadership Summit coming up on the 5th and 6th. And you can find information that'll link you to that on our website. And then just finally, let us know how we can help you. Go ahead and feel free to contact us at nopn.org/contact. And for more information about upcoming events and other opportunities, please sign up for our newsletter. So thank you to everybody for being a part of this with us today. And thank you so much, Dr. Levy. And I really appreciate your spending the time with us. And thank you to the producers who in the background always make this work so smoothly. So goodbye to everybody. Appreciate your participation.